Let's talk about the next determinant of health, that is known as environment. You have heard of Hippocrates. Have you heard of Hippocrates? He was a philosopher, also a scientist. He first related the health with the environment, considering some factors like climate, water, air, etc. So that is the external environment, which have impact on our internal environment as well. If you see that in your environment your water is polluted or your air is polluted and your climate condition is not suitable enough, will that have impact on your health? So is it determining? So this is another determinant of health, environment, a big determinant. Exactly. So it is getting difficult for you to adjust. Certainly. So another example. Then for long time, if you live in a polluted environment like climate, water, air, this will ultimately have long-term impact on your health. Certainly. I have, before some years, I read an article in the newspaper that about the traffic police. In Dhaka city, there are a lot of traffic sergeants. What do? That they always try to maintain the harmony in the road and to avoid the traffic jam, whatever. But they have to stay on the road always. All the time they have to face the dust, polluted air, at the same time noise. All of these are environmental factors. And ultimately what the research has shown, that the average life expectancy of a traffic sergeant or traffic police in Bangladesh, it's low. The average, they don't live for a long time because throughout their life they face lot of environmental degradations. They are under constant pollution, noise pollution and other things, and which ultimately reducing their life expectancy. So you see that how environment is being a big determinant of health in some certain portion of the communities. We can apply the same for some factory workers. They are always in a heated environment with too much noise, sound, and ultimately we see that in their old age they are having a lot of diseases because they didn't have the proper environment.